It's right now 8:04, 4 minutes after 8 o'clock, and good morning, ladies.
Good morning.
Good
morning,
morning.
Al.
Good
Got
morning,
that
Al.
record button on?
Do what now?
You got that record button on now?
Oh, yeah, it's on.
All right, okay.
You're recorded right now. See, everybody heard you ask that question.
Hi.
Hi, how are you?
Good. My name is Sandy Rice, and with me is Nancy Silvertooth, and this is Common Sense Matters, sponsored by the Franklin County Democratic Party. Let me do a few updates and announcements. The George Fraley Memorial Barbecue was on September 28th. It was a big success. Did you have a good time, Nancy?
Oh, yes, it was great. One of the best Democratic Party attended events that we've had in some time.
Okay.
And I would say that it was a success, yes, and we
Okay.
had fun.
Well, we shared the night with lots of other events and travel plans, including a fundraiser in Suwanee and the Franklin County Fair Beauty Pageant. Some of our members were involved in. We honored George Fraley and certainly a gentler time in politics. Thank you to speakers Representative Tidwell, who served with George Fraley in the House of Representatives, and especially to Representative Gloria Johnson, a current member of the House from the Knoxville area. House Minority Leader and Representative from Memphis, Karen Camper, was unable to attend, but we are scheduling a visit from her as soon as possible. Thanks to all who attended, bought tickets, made donations, and bid at our silent auction, as well as all the members who did so much work. Truly busy in September and October, we had our new tent up at the Cowan Festival, September 20th to 22nd. We chose not to wear or sell snarky hats, t-shirts, or bumper stickers, but instead had a bake sale on Saturday morning, face painting daily by Suwanee artist Mary Priestley, and talked to people about the issues they are concerned about. The face painting was a big hit, Nancy, if you were there for that.
I noticed that, right.
They lining up.
Lining up,
Okay,
yeah.
we had a booth at the county fair too and talked to lots of people there. Thanks to everyone who volunteered and sweated out all these events because this was in our heat wave. Our next party meeting is October 15th, beginning at 5:30 at the Franklin County Annex. Look for the directional signs. Nancy, we have two new mascots, Keith and Kelly. Both photos of adorable Democratic donkeys because all donkeys are Democrats. Did you know that?
Oh, yes, I've learned that early on. That and the Yeller Dog Democrat.
That's
what
right.
a Yeller Dog Democrat is.
Well, Keith directed folks to the barbecue, and Kelly will show you the way to our meetings. Our guest this month on the 15th will be Jordan Wilkins from TNDP, the state party. I'm not sure of his topic exactly, but he is young and energetic, so please come and catch some of that. And finally, welcome to all our new members. We did a phone bank calling Democrats the last couple months and added many email addresses to our newsletter and phone numbers to our call list. What I told the people I reach is that we want you to be involved. Do we want you to volunteer and give money? Of course we do. That's how any organizations run. But mainly, we want to see your face. It gives all of us hope and strength, and we hope it will give that to you as well, and you will want to be involved at some level. Plus, you can be with like-minded people who share the same values, shock, and sadness of our times. Our meetings are not as relaxing as a night at home, and our events are not like a weekend in Nashville, but come and be with us. Okay. Our topic today is the Medicare Block Grant proposal. Have you heard about it? Governor Lee wants Tennessee to be the first in the U.S. To take on this project. It would radically change how our state provides care to 1.4 million people, including half of our children. Nancy is here to help me with this complicated issue. So here we go, Nancy.
Okay. Yes, it is complicated, very complicated.
But I think we can break it down. So,
I believe we can.
And our listeners will know more than most of
Right.
Tennessee.
Of course, what it amounts to in the end is poor and sick people being able to have health insurance.
Okay.
And children. We have an issue. There's been an issue just in the past several months with malfunctions of our Department of Human Services and TennCare, in which many children are now off TennCare.
Right.
And anyway, that's all
That are
sort of
eligible.
wrapped up, right, that are eligible. And but anyway, the Medicaid block grant that we're talking about is not going to cure that, and you got the details on it.
I do. So a little bit of history, and this is real important to know about Medicaid. Okay, it was signed into law by President Lyndon Johnson in July of 1965 to be a public health insurance program for people with low income. The cost is shared between the federal and state government. Okay, Medicaid is not commercial insurance. It covers desperately ill, chronically ill people that commercial insurers generally do not cover. So what works in a commercial plan for a general healthy population, generally healthy people, does not work in a Medicaid context. It was designed to serve a population that commercial carriers avoid. I want to put this in about disability. It's not your neighbor that's off work with a disability but playing golf every weekend. That really makes people mad. This is not Medicaid. That's Social Security income or work comp or fraud or something. These people are severely, children and adults with severe disabilities with very high health care needs. Our program is called TennCare, and it has gone through many changes since 1965. Currently, it covers low-income pregnant women, low-income parents of minor children, their children and adults with disabilities, and low-income elderly on Medicare and in nursing homes, all considered vulnerable populations. In other words, people with high medical costs, which are difficult to cover with Social Security or other sources of income. So I said low income a whole bunch of times there. Okay, now in 2010, the Affordable Health Care Act was signed into law and included a provision to expand Medicaid to low-income people not eligible for traditional Medicaid, but income too low to receive the ACA health plans. And I've been on here talking about, this before. With my experience volunteering in Grundy County, a lot of people uninsured up there because they're working, but they work in low-paying jobs, undervalued jobs, have lots of responsibilities for children, neighbors. We have grandparents taking care of their grandchildren because the parents are gone. All those types of things do not get Medicaid unless they're a caregiver for a child. They might be self-employed, seasonal work, that type of thing. Okay, Nancy has worked for years with these folks trying to get them on the ACA. And one thing that's always stuck with me is that you try so hard to find sources of income that will elevate them to an ACA plan and not Medicaid.
Right. To make that, they have to have on the Affordable Care Act, formerly usually started out being known as Obamacare. We refer to it mostly now as the Affordable Care Act, or ACA. When you apply for the ACA, you have to estimate. Now, it's an estimate, and that's going to be coming up soon, starting November 1st. You have to have an estimated income of at least what would be the 100% of federal poverty level, and for one person, that's almost $13,000 a year.
Wow. Mm-hmm.
And some people that have part-time jobs or no jobs, that may be disabled, have a disability claim pending, they're just out there lost.
Yeah.
Unless, as you say,
So you try to get them on.
Try. I'll ask them, are you living with someone? Well, yeah, I'm living with my mom. Does she have income? Yes, she has Social Security. Sometimes with that two-person household, if it amounts to the 100% poverty level for a two-person household, bingo, you can get them for that household.
Because otherwise
Yeah.
they're in the gap.
They're in the gap.
They don't
They're
fit
in-
any of these.
They're not qualified unless they're qualified for some category of Medicaid, like I believe you mentioned.
If they're pregnant.
Pregnant, women with breast cancer.
Okay.
The caretaker relative, parent or grandparent or aunt or uncle taking care of young children, and they're low income, they can get Medicaid.
So,
There
again,
are some categories, but many people, and it grows every day, I think, in Tennessee, especially with even the latest happenings with TennCare, that, and of course we read articles about so many thousand children have lost their TennCare coverage just because of glitches in the TennCare
glitches
system.
In the system. Okay. But the ACA required states to have Medicaid, this Medicaid expansion, the government paying 90% of the costs, and the states coming up with another 10%. So let's see, Affordable Care Act 2010. Well, in 2012, the Supreme Court ruled that states could not be required to expand Medicaid, so it became an option. To date, 36 states in the District of Columbia have opted for the expansion. Okay, let's talk again about Medicaid expansion in Tennessee. In 2014, Governor Haslam developed a proposal to expand Medicaid. Not only did it not pass out of committee, but the legislature ruled that neither the governor or the people of Tennessee could ask for a bill to expand Medicaid. It had to be the legislature. Okay, what's significant about it not coming out of committee is that it was never discussed on the floor amongst our elected representatives. Now, they're supposed to come back to us and ask what we think about things, or at least, be aware of how the constituents might feel about a health care plan. But that never happened, and then they took both the governor and our right to ask for a bill. It just has to be the legislature. I'm going to talk, and they've been vehemently opposed to even considering it, as far as I can see. I've been in Tennessee for 4 years, so I've not seen any signs of.
Right.
Even before the legislature goes into session in January, there's articles about how they're saying no way, no way, no way. I'm going to talk a little bit more about a personal experience that.
Pushing now the quote block grant.
Right.
That
now we have
Governor Lee is especially pushing has been. And could I, as a background to all of this, and I'd like to interject here, when Governor Lee said, when I first read that he'd made the statement that this is the only state that's doing this, immediately, my mind went back to articles I read when the Affordable Care Act went into effect, and states had to start getting ready for it in 2013 because it was going online on January 1st, 2014, when our state legislature and our state TennCare administration saw that this was happening. They were so against, I've seen the word, had such an antipathy toward, a deep-seated dislike, hatred maybe even, for this Obamacare that was coming down the road. Tennessee laid off more than 100, I read somewhere 121, might have been more than that, laid off DHS workers that could have helped people with this new system coming on. But they heartlessly, cruelly laid, and so people, when the system did go online January the 1st, 2014, of course the federal computer system had problems, but it was terrible. People could not get their children on TennCare, and the Tennessee Justice Center, you're familiar with the law firm Tennessee Justice Center, they filed one lawsuit. There had to be at least 2 different lawsuits filed against our Tennessee officials for not following the federal law. Of course, they're getting the money for Medicaid comes from the feds. And so this started, and we're having, I believe this is Governor Lee's day of prayer. My prayer would be that these people, one thing more I meant to interject. After Insure Tennessee was killed in committee, as you say, that would have been sort of a Medicaid expansion. There was an article, front page newspaper, I believe National, what's that? It's not the Tennessean, but they're associated. Anyway, front page, a man named I think it's Andrew, it was Andrew Ogles, president of the Americans for Prosperity, took credit for, openly, proudly bragging on, taking credit for killing that, having the political influence to kill that bill in committee. Now, in my mind, are our legislators and Governor Lee, are they still under the influence of this Americans for Prosperity, which is connected with Koch brothers? You know, if they can't, if they're under, it makes you wonder, because why would they not have some sympathy for children, anybody sick, not having health care? And so on this day of prayer that Governor Lee is having, I would pray that if they're still under the influence, if they're doing this because of some political influence, I would pray that that hold be broken and that those legislators be able to do what's right for the people of Tennessee.
Amen to that. Okay. So, enter the Medicaid block grant. Remember in 2016-17, attempts to repeal and replace the ACA, then repeal and come up with a health plan later? All that failed. The idea of a Medicaid block grant was part of that legislation. Since then, not only has the ACA suffered many attacks to weaken it and make it less effective, but we still have no real health care system nationally. Even controlling drug prices and surprise bills are stalled. The current administration, federal, wants to cut $3 trillion from the U.S. Medicaid budget using block grants. So during the 2019 Tennessee legislative session, the State House and Senate passed a bill requiring Governor Lee to submit a request to pursue a block grant. Now, a traditional block grant would provide a state with a fixed amount of federal funding adjusted for inflation. If you go over that lump of money, then the state's responsible. Okay, the current block grant is modified. It asks for an increased amount of money if enrollment grows. It requests to exclude hospital payments, costs for Medicare, Medicaid patients, cost of care for intellectual disabilities, children in state custody, and outpatient prescription drugs. So this is quite of arrangement. It's asking for a lump sum of money except for these special areas. But here's the important part. For this arrangement, we would split any savings with the federal government. Governor Lee has proposed saving $2 billion from the Tennessee Medicaid budget. So we could split that 50-50 with the feds. We use $1 billion. Now, I looked this up a couple times just to make sure, because it's really quite surprising, that in our Medicaid budget for the last couple of years, we've saved that much, the money that we've gotten under TennCare, and we've had to send it all back to the federal government.
Right.
So we want to get $1 billion of that back.
Federal tax money we're paying is going to other states that could come to us if Medicaid were expanding. Right.
Not Medicaid, just our traditional Medicaid, what we've been working on.
Yeah, traditional Medicaid, not block grant.
Right,
not the block
right, but
grant
under a block grant, instead of giving our saved money back, we could keep half of it.
Oh, yeah, I see what you mean, and of course, also our disadvantage now is in those of us that have fought for insurance, for Medicaid expansion for years, and for health coverage, for affordable health coverage for those who can't afford it. Before 2016, we had the government in Washington that was on our side. I mean, that but now we're fighting the feds too. And of course, it has been said that I don't know how true this is, that Governor Lee's proposal is in lockstep with the Trump administration.
Oh, yeah,
and of course, I do know that from the rules that have changed, our present administration has passed every order, regulation that they could put into effect without getting Congress to do it, that would make it harder for people to get to sign up for the Affordable Care Act or insurance. They've done it. They make it. When I go to read the rules, I have somebody with an unusual, like moving, moving from one county to another, moving from one state to another, the plans change. And that is a cause for a special enrollment period. Now, the Trump administration added a provision that, well, you don't get the special enrollment period even if you've moved, unless you've had the insurance before at least one day out of, just restricting every way they can. And what is so hard to understand, this is the lives of people who are suffering and dying without insurance.
Right. Well, I had to double check this, that we were actually getting money and then sending it back. Okay, so in the executive summary of the proposal, Governor Lee has been quoted saying this as well, so I'm just trying to make a clear quotation here, but he feels that Tennessee TennCare feels that Tennessee operates one of the most cost-efficient Medicaid programs in the nation, routinely underspending the federal government's projections and saving the federal government and taxpayers billions of dollars.
Who says that?
That's in the executive summary, but Governor Lee has been quoted saying that as well.
Okay.
He said in an interview with federal officials that they need some examples to show the rest of the country how to do this, and we have an example. We have conducted ourselves as leaders handling Medicaid in cost-efficient ways for years. Here's my note. What? Yeah. Okay. And I've shared these statistics, but I just have to say them again and again and again. Tennessee ranks, I think we're at 43, but out of the 50 states in certain healthcare indices, we're in the lower 10 consistently for years. We have 300,000 uninsured. Infant and mortality rates are increasing. This is worsened by hospital closures, because you'll close a hospital or a hospital is taken over by a corporation. What's the first thing they cut? Labor and delivery.
Right.
Because it's expensive to have staff there. Yeah. So we're not doing so well. Cancer deaths are increasing. Opioid deaths across the country are stable or decreasing, except for ours. Our cancer death rates are increasing. Opioid deaths, because we don't have a program. We're not spending any money there. The life expectancy is decreasing in Tennessee. And we have the most rural hospital closures per capita in the U.S., with many others in financial peril. I think earlier this week there was an article about Manchester Hospital that's struggling, and that's near Bonnaroo. So, I don't know, efficiency versus effectiveness. We're in the top 5 states that spend the least amount of money per Medicaid beneficiary, and I think it shows. It shows, especially in our rural areas. Another thing that's really something about this proposal is that it asks to be flexible, to be allowed to be more flexible from excessive or unnecessary federal intervention in order to allow the state to administer this program more effectively and to promote the health of TennCare members. Additionally, flexibility will focus primarily on issues that will empower the state to implement improvements, efficiency, and other reforms to make TennCare stronger and more effective without negatively impacting who is eligible for the program and what services they may be eligible to receive. Oh, that's a lot of words. I could have said that shorter.
Did I understand you to say in what you just read that Tennessee has a proven record?
But that's what TennCare and Governor Lee and apparently the legislation.
Tennessee's record is terrible.
It is.
I mean, when you mentioned, and I don't think I ever said what I meant to, I get myself sidetracked. when Governor Lee says we're the only one, Tennessee's the only one in the country that's doing this. An article that I've still got and that I run across, and where I mentioned the DHS workers being laid off, there was an article at that time. I found it and going through my stuff. Tennessee was the only state in the country that laid off their DHS workers, making it nearly impossible for people back in 2013 to 2014, when they knew the hated Obamacare was coming. Tennessee laid off immediately, I think effective January the 1st, 2014, laid off hundreds, I think it was over 100, I've got the figure somewhere, DHS workers so you could not go to, when you had trouble, the people that didn't have a computer, couldn't operate a computer, couldn't get insurance. So don't tell me Tennessee's record, and then even Tennessee Justice Center. By the way, there was an article that says Tennessee Justice Center, they are the experts. They know what they're doing. They've been in this from years back, representing TennCare people, and they know what would work for us, or they know that this block grant thing wouldn't work.
Right.
But Tennessee's record with taking care of sick people and children and their TennCare program is awful.
Right.
And we can and that to think that they have the nerve to come along and say that, hey, give us this money in a block grant so we can do what we want to with it.
With no government
With
oversight.
not even.
Just
That's
it's
crazy.
a blank check.
Folks, my Republican friends out there, please call up your Republican legislators and Governor Lee and beg them to do the right thing and just expand Medicaid, have it done as how many other states have done? 40-something.
Well, 36.
36,
and then
okay.
D.C.
And take care of these people. I don't understand their position unless they're just being politically controlled by somebody out there. So please call them up, and you're all the ones, other Republicans, that can change their minds. We can't. They won't listen to us, of course. But this is so critical for children. And while I'm ranting on that subject, can I mention one other thing? You mentioned opioids. I had a conversation. I ran into Christine Hawkins at an event lately, and she just made the comment in talking about her program, the jail reentry program. She said, we can get people jobs. I can get them jobs when they come out of jail. They work, of course, we know what Christine Hawkins' reentry program does. She has federal grants. She's worked with this grant money for years. Worked with people in the jail. I worked for about 2 years, and I know what they do. It's wonderful. But anyway, they get them jobs. They try to help them with their resumes, help them with their interviews, and know what to do on a job. We can get them jobs, and we got interrupted at that. Somebody said something and it got her off on something else. But in my mind, I thought, I'm coming back to that. I said, Christine, what's the but? Why can't they stay with these jobs? Her answer, drugs. Mm-hmm. They're pouring out of our jails with mental health issues and drug issues, and that's a fact. I don't think anybody could argue with those are facts. They need treatment. I know Diane Hand, probation officer, state probation officer, now retired, made the comment, while they're in jail, they're getting their medicine.
Right.
By law. They're getting their medicine. Whatever they need, they're getting it. When they come out of that jail, they're not.
Their medicine to control their
right, exactly.
Urges.
When they come out of jail,
opioids.
unless they have insurance coverage, and most of them don't. Some of them may have Medicaid already. And what are we doing, taxpayers? Just go down the road and look there at the jail. We're spending. Guess who's paying for that new addition at the jail? Just guess who? I believe it's the three of us here.
That's right.
Yeah.
That's right.
And people and President Trump himself recently, and I think he's right about it. At some recent mass shooting, he blamed it on mental health, and he might have been right about that. And let's do what's right and treat these people that not only help the people, but all of us, society. Mm-hmm. And so please, I beg you, Republicans, call up Governor Lee and just pray as hard as you can. I hope that they will change their minds on this Medicaid thing.
Well, it's in a public comment period right now. So this has been submitted to the government, and there's a couple of, I think it's the Center for Medicaid and Medicare Services
Yes, they have to
Okay,
approve
and
it, I
what they
believe.
do then is they look at it and they ask Tennesseans, TennCare, to have a 30-day comment period. And that's what we're in
Is
right
that what
now.
we're in now?
Yeah, right.
Right.
So it's really, for now, it's kind of beyond the legislators and possibly Governor Lee. So I do want to tack on to your Tennessee Justice Center. They're a nonprofit. They probably wouldn't want us talking about them. But they're a
Well-
group of lawyers and other professionals that really are kind of the watchdog. They're advocates for especially children.
Right.
But they're kind of watchdogs on TennCare, and they've taken them to court, TennCare, 6 times and always
Right,
won. So
right.
so they have a lot of information and have really followed it for many, many years. But
Tennessee Justice Center, and they also, any group phone conversation I've been on, and you've been on it with them too, they'll say we are nonpartisan.
Right,
And they
nonpartisan.
are. They will not come out for a particular candidate.
right. But they're looking at the issues alone.
But they were, they were formed, I think, years ago, as a nonprofit law firm to help
Right.
TennCare,
Right.
TennCare patients, TennCare
Right.
people being kicked off of TennCare.
Right. But the comment period goes till October 18th. And if you want to make a comment, I found the best thing to go to would be, and this is long, I'm sorry, get your pencils. Should I give it? You got your pen.
Okay.
Is www. Here's where it gets tricky. Tennessee Justice, TNJUSTICE, that's easy, .org,
Yeah.
/Medicaid, MEDICAID, block, BLOCK, grants, GRANTS, in Tennessee /. Now this will give some of this information that I've been, giving. And then there's, you can enter your name and your information. And then there's a form letter that you can review and push send. You may delete that story and tell your own story or modify it. You can also write to Mr. Gabe Roberts, ROBERTS, the first name is Gabe, Director, Division of TennCare, at 310 Great Circle Road, Nashville, 37243. Do we have a phone call?
You do.
Okay. Go ahead, give it a punch. Hi.
Yeah, hey, I've heard, the comment period goes until October 18th, right?
Right.
Okay, so I've heard that almost all of the comments that they've gotten so far have been against the block grant.
That's right.
They haven't gotten... I just think it's so funny how Republicans are always doing things that are the exact opposite of what their people are clamoring for.
That's right.
You know,
That's
like-
right.
The vouchers. Nobody was protesting out in front of the Capitol asking for vouchers. Nobody has been protesting out in front of the Capitol asking for block grants.
Well, they are
And those are
right.
the things that they want to do.
Well, and I think it's interesting with our last election in the state for governor, Carl Dean went around with the plan for Medicaid expansion, and Lee had nothing, and then he said he was going to have a plan, and everybody believed him and voted for him, and now this is the plan.
Yeah.
So
He's always wanting to do these risky, untested experiments.
right. Well, and he's always kind of flavoring.
All right, I
his-
just wanted to make
Okay.
that comment that I had heard on WTLN and through the Tennessean that overwhelmingly
Right.
everybody contacting the governor's office has been begging him not to do this,
Right.
and yet they're plowing forward.
Right.
And
right.
then same thing with the vouchers. Like, I don't know the exact percentage, but the overwhelming percentage of people were against it. Iris Rudder even promised she wouldn't do it, and then they just went through with it.
Well, because they
I
renamed
just think
it.
it's interesting how unresponsive the Republicans are to people
Yeah. they need to go.
wishes. But that's all I have to say. Y'all have a great day.
Okay, thank you.
Hit the speaker button.
Okay, and I attended one of the public forums, the first public forum. I went up to Nashville, had a very nice lunch, and then I was like the second or third person
I
to be
believe I got a
chosen.
glimpse of you on TV. There's Sandy. Good, yeah.
But and Representative Jim Cooper spoke, and there was a lot of organizations there, and they had lots of calm questions and their concerns, and they expressed them very well. But many people bore witness to the errors that TennCare has made that have made their lives much more difficult. A mother of a disabled child with a limited life expectancy found one medication. She was hospitalized. Her daughter was hospitalized. Found one medication that could keep her at peace. In the final time that she had. I don't know what the drug was, but it was not on the approved list of medications with TennCare. It was too expensive. It was denied. So she was spending 6 weeks, had spent 6 weeks trying to get her daughter to be allowed to have that medication paid for, 6 weeks. There was a blind woman who couldn't seek medical attention for a prolapsed uterus for a year because TennCare stopped paying her Medicare premiums and her Social Security check wasn't enough. I don't think I talked about this, but those of you with Medicare know that there are some premiums and co-pays and all those types of things. So if you have a very limited income, you need help from Medicaid. All this is means tested. You have to prove all this stuff. You just don't be in line. But TennCare has stopped paying those by mistake for some people. And the way they find out is they get their Social Security check, and it's like hardly anything in there. What happened? Well, if Medicare doesn't get the money from Medicaid, they take it out of the person's Social Security check. So this was another error. There was an attorney there who had fought for 2 years to get his HIV client treatment for hepatitis C. This is very expensive. It was denied. It was too expensive, and then she wasn't sick enough. She died. And then my testimony was about the patients I see in the free clinic, how they're not covered, and they come in for episodic care. They've cut a finger. They think a bump is cancer, and while they're there, we just go ahead and screen them for other chronic diseases that have been undiagnosed or mismanaged. And we do what we can. We work really hard to put things together for them and help them understand they need to have this followed up. But all these situations, I and other healthcare professionals are working so hard, and this mother with a child that's going to die within a couple years, and this woman is suffering from, I'm not going to go into uterine prolapse, but some of you people know about that, you gals out there, and a patient that died. This is multiplied over and over again throughout the state. And then TennCare sending back money to the federal government. These people need help, and this is what's happening.
Tennessee's good record there.
And this is efficient, effective care.
Of course, when I first heard the words block grant and realized that would give Tennessee administration more control over it, I thought, oh no, because from 2013 when we knew Obamacare was coming, all through the years, I knew I had kept up with, worked on this insurance, and what Tennessee TennCare administration had done, and the legislature, was all anti-sick people.
Yeah. Well, people. As a healthcare provider, I found that the Tennessee legislators who directed this proposal to be largely unconcerned for the poor and sick. Certainly adamant refusal to expand Medicaid despite public support to do so, and positive data. Okay, we've got 37 entities across the country that have been doing this for years, and some of that data is starting to come out, as well as the ACA. That was just recently. In healthcare, it doesn't just bam, you have results. It takes time, and so we're seeing positive programs. Our Attorney General is one that's trying to outlaw the ACA completely. again, despite public approval and positive data. I don't think people realize, and certainly our Attorney General, how much the ACA and some of the things that it put forward are in so many aspects of our health care. So if the judge there would decide the whole thing is unconstitutional, well, I guess I'll probably be here if that happens, but I wouldn't want to be. Also, they've tried repeated attempts to pass work requirements that have resulted in even higher numbers of uninsured in other states. People in Arkansas have to find a computer and log on and record their orders and what they've done. I think a refusal to increase the minimum wage, and there are statistics about how little our minimum wage, and it hasn't changed in 12 years maybe. And if you paid people a better wage, they wouldn't need, food stamps, but trying to eliminate food stamps and any type of public support, but then keep them down, keep them poor. But as I said, on a personal level, I had an email exchange with a state senator who was publicly saying no way to consider Medicaid expansion. This was months before the session even started. He was rude, condescending, and arrogant. So this whole thing I shared with my state senator, and you know what she did? She didn't respond to me. She blocked me. So you want to hear that?
Yeah.
Okay. I've heard people say in the legislature, able-bodied but not working. They're just trying to collect checks and are living high and driving Mercedes. Okay, I drive around Grundy County, and I've never seen anybody with a new pool or grilling steaks. I see poverty. And struggle.
Right.
The phrase Mercedes moms permeates the Capitol. These are moms just having babies to collect all that Medicaid money. And again, Mercedes moms, people taking advantage. This is disabled, seniors, people in nursing homes. So, and then we are told there is a commitment to rural communities about this proposal that doesn't include any funding or any plan for rural hospitals or care for the uninsured. I think Governor Lee uses a lot of flowery language, and in talking about the executive summary earlier, we see health and empowerment, and we want this, but there's never ever real action plan for that. It's just words, and we're going into our second year, and if people aren't noticing that, they need to upgrade their critical thinking skills and look for those words. What does that mean? It sounds pretty. We want to improve everyone's health and wellness, and we want to do that, but we got to keep people from getting sick, being sick. And finally, there is much speculation that this plan will not be approved, the waiver. U.S. House Chairman, this was in the paper recently, said, I think it's Representative Pallone, and I'm not sure where he's from, but he's House Energy and Commerce Chairman.
Oh, I saw that. Yeah, he says he thinks it's illegal.
That it's not been done before. The president can't just say this is okay and do it without congressional. I know that we're kind of skipping Congress a lot lately, but
the active Congress up there now, they're on fire. They'll do something. They do nothing basically.
Yeah.
It's a Mitch McConnell, of course, Senate, so they're not going to.
So, but the point is that through the legislative session, January, February, March, I don't know when they stop. They go longer than Georgia, I know that.
They go to sometime in April, usually, about till the last of April, mid-April, something like that.
And they passed two major pieces of legislation. One to proceed with the block grant, that's probably illegal, and then there's some question about the vouchers. So there seems to be precedent for that on the federal level. So at least for this, we wait.
Right.
You know how the court system works. It's not going to be next week they're going to decide this.
You're married to a lawyer, so you know too.
It moves slow.
Slow.
It moves
that's right.
slow.
Exactly. Wheels of justice turn slowly. Right.
And so, I don't know what the time frame would have been if we'd had Medicaid expansion, but the mechanism is in place, would have been in place if we had gone that route. It's not in place, for
right.
this.
Right.
So all our people, all our disabled, all of our, are going to kind of go along with what we have, whether it's adequate or not. And the children, 200,000, they think it's kind of hard. A lot of them were kicked off of their TennCare, and some, maybe. I guess there's a mention in the block grant that this is going to reduce fraud and abuse. There were 100 cases of fraud and abuse of people on TennCare that didn't need to be, out of 1.4 million.
There's going to be fraud and abuse in just
Well,
about anything
you
out
get
there.
into medicine, and there's a whole lot of
yeah.
potential for that, and then just ripping off some of these requirements, wanting more flexibility is a problem. But I have a friend that's a pediatrician, and she had twins. Not her, twins, patients.
Twin patients, yeah.
And one was on TennCare and the other wasn't. So,
Wow, yeah.
And then I met a girl in Jasper, 16. She had diabetes since age 3, so she's had an infection or something happened that's destroyed her pancreas. She's not like, our peers and her grandparents that they develop that over time. So she has to have insulin. She was kicked off of TennCare, and her mother called and called and called and called to get her back. She had to borrow insulin from other people, her grandma and some other folks, and it was months calling and calling, and probably about out of time, but I worry so much about the stress of these folks.
Well,
You know what it's like to have the sniffles. It's stressful,
Well, and I think
let alone a
I
disease like
think
some of these.
so many times, way back, and of course I can remember years ago, of course, struggling with this insurance and not being able to get insurance. But anyway, I think of the time when my grown granddaughter called me up. It's been in the last couple of years. She said, "Grandma, I'm so sick. Will you take me to the doctor? Take me." So I went and picked her up. She was like, had a pan with her, just sick. And she had insurance. She's still on her parents' plan, I believe. We went down here to the little medical clinic, and when we walked in, when they saw, said, here's a pan. And I thought of that so much. Wouldn't it have been awful if I'd had to take her to the emergency room? And of course, that was not a life-saving, and threatening thing. But how awful it is for people that don't have insurance to have no choice when they get sick, but to head for the emergency room. And if it's not life-threatening, you're going to sit there for hours.
Right.
And there's so many like that. Are you at a place where I could throw out some dates that I want to for people?
Yeah.
If you want to go ahead, just give me a couple of minutes.
Well, let me just finish this
Yeah, go
thought.
ahead.
These are
Go
the
ahead.
people. These people have insurance. They have Medicaid, but they're dealing with. They're in a wheelchair. They're paralyzed. They have to have an aide come and help them so that they can live independently, or they need to have services so they can stay in their home and not cost the system more by having to be hospitalized or in long-term care. And so they're dealing with that and their bills and their medicine and their food. And then on top of that, TennCare makes a mistake and they have to be on the phone and worry and the stress of that. And now this whole block grant is causing even more stress. I mean, just people don't need that.
No,
Sick people
that's exactly
don't need
right.
that already have so many challenges. So I hope that you were able to get those addresses. You can go, you can contact. I would say the best is if you miss these or want to make a statement, to go to Tennessee Justice. Their website doesn't have this, but I would actually call them, and then they could give this to you. I'm not quite sure right off the top of my head.
Yeah.
I can make. And you can check the newspapers too. The Tennessean, the Times Free Press has covered this really well. If you don't get a paper, our Franklin County Library, those people are great over there, and they will help you find this, or the papers are there.
Yes, it's
to look
amazing
at.
what our local library, what they provide there. It's absolutely. Of course, I think we've had her.
Yeah, she's
Miss
been here. I
Stevens
think
on
she
it.
has a show
Yeah.
too. But go ahead and give your dates
Okay,
for
my
AC
dates.
sign up.
Okay. Lately, I've been involved with people. When I started out in this insurance thing, trying to learn everything, I realized how complicated it was, and I started out in January of 2013. Actually, Donna Seeley from Tullahoma, nurse practitioner, just like you, retired and realized how hard it was, what was happening to people without insurance. Anyway, I started out trying to learn all I could about the Affordable Care Act. Then I realized I had to learn about Medicaid too if I was really going to help people. Lately, I've gotten into another phase of it that I didn't intend to, but there's people need help with it. And this is, and you mentioned it, people who are on Medicare either by being 65 or disabled. And if the situation is just right and the income is right, they can also get TennCare, Medicaid, and for some reason, and that pays all. If they're on the QMB portion of, like they call it, medical savings program, they get everything paid for. What Medicare doesn't pay. But anyway, this is a problem for some people, and I want to tell you this. I'm going to go to this. I'm going to have to ask off from work to do it, but they'll let me off. October 17th, that's next week, at 10 o'clock, it's 10 or 10:30, I believe it's 10, at Senior Citizens, right here, not far from us, at the Senior Citizens, they'll have a lady there from SHIP, that's the state, it's a state health insurance program connected with the federal program, and SHIP is a Tennessee agency that helps people with insurance and other issues. The lady that's going to be there on October 17th is going to be talking about the Medicare plans that are out there, because the people that have Medicare, for some reason, you usually need a supplement unless you've got Medicare Advantage. You need a supplement. She'll be talking about the supplements and Medicare Advantage. Medicare Advantage is that's a whole different ballgame in a way. That's October 17th at Senior Citizens here in Winchester. Then you need to know, if you don't already, from October the 15th until December the 7th is the date of open enrollment for these Medicare supplement plans. If you're like, oh good, Al's handing it to me, 10 a.m., yeah, SHIP, Medicare presentation, Al's on the ball. He's handed me the notice from Senior Citizens, which I couldn't find this morning.
Did you get it right?
And what I was, let's see, what I wanted to, okay, here's what I wanted to read. This SHIP program, they're non-biased. The SHIP program provides free, unbiased information to people on Medicare and their families. The part of the help is screening people, is screening people to see if they qualify for the extra help program with their prescription drug costs. So it looks like she'll provide some on-hands individual information there. So it's at Franklin County Senior Citizen Center, 74 Clover Drive, Winchester, which is sort of behind the hospital. You can call me at 962-4982, and I'll give you more information if you need it. And I also wanted to mention, now that's October 15th to December 7th, that you get mail from, like I do, because I'm on Medicare too. You get mail from these supplement programs. Your mailbox is full by now probably. So you know that October 15th to December 7th, you need to keep that December 7th date in mind, because that's when it expires for you to sign up for a new, if you want a new Medicare supplement plan. Another date, one more thing, Affordable Care Act, open enrollment is November 1st to December 15th. You want to get signed up if you possibly can by November 15th, because if you get signed up by November 15th, your plan goes into effect. Well, it might also by the 15th, by December 15th, but your plan goes into effect January the 1st. If it's after November 15th, it may go into effect in February. But anyway, as soon as you can, get signed up for the Affordable Care Act starting November 1st. And I don't have any premium information yet. I've looked, but they say it'll be up right before November 1st. And have I got another minute?
Yeah.
Okay, here's what I want to say in my last minute, if I've got one. Sandy and I have talked about this morning. Of course, the poor people, sick people. You know, anybody with any of the, Mr. Joe Bean used to say, the milk of human kindness running through their veins, ought to be sympathetic to these people. And of course, so many of us are familiar with what Jesus said about the least of these in Matthew 25. And you wonder why the positions that our state administrators, legislators are taking the position they do. And what gets into that sometime is people are turned off by anything Democrats propose because, oh, y'all support abortion. I want to tell you, that's wrong. That is, you're flat wrong. I don't know anybody that, quote, supports abortion, Democrat or Republican. I ran for office for state rep in 2016. I went to Nashville on candidate training sessions by the Tennessee Democratic Caucus and Tennessee Democratic Party. Never, ever, ever did I see one printed word or anybody tell us, now you know you got to go out and say you're for abortion. Absolutely not. But what did we support? Wages, living wages for everybody. So that woman that might think she needed to get an abortion, she wouldn't need to. She's makes enough money that she wouldn't even consider such. She's have health insurance. We push health insurance, as you see here this morning. Of course, public schools. Everything that I was told to that we supported, and nothing in there said that. You know you got to support abortion, because we don't. Of course, what we do, we're a big tent. We support everybody, that mother that's pregnant and having to deal with making the decision. I think of the way Jesus would have treated her along with everybody else that he met. Everybody gets a non-judgmental, fair shake, and their rights are supported. And nowhere do we say, have you ever seen it? Have you ever seen anything that says, now we support it? No, but that it's so, people are so misled out there into thinking, I can't vote for anything or anybody that the Democratic Party stands for. And to think that Democrats, quote, support abortion, what we do is support the rights of every living human being. And I like to think of it as we think that Jesus would treat everybody. So that's my parting thoughts. Sorry for going on and on.
No, that's fine. Thank you, Nancy. So thanks for listening. It's a lot of information. Give Nancy a call.
Yeah.
Anytime, day or night, and we'll see you next month.
Right.
All right, thank you.
You're listening to WCDT AM 1340, W295 FM 106.9 in Winchester, Tennessee.
Are you looking for a home-cooked meal for lunch today? How about sweet tea and a homemade dessert? Then you should stop by Betty's Diner on Main Street in Deckard. Betty's Diner is open Sunday through Thursday from 11 a.m. until 2 p.m. And now, a look at your weather forecast.
Lots of sunshine today.